of this. And so welcome, welcome. I am Angelique Beslick. I am with the Healthcare Supply Chain Hub. I have every Tuesday and Thursday a 30-minute free weekly learning bites, I call them. And I want to give you guys some massive action to take tomorrow and go implement it at your workplace. That is the purpose of this. So we're going to just kick it off, get moving, and then afterwards, I'm going to send you guys the recording, the PowerPoint, and the massive action worksheet so that you guys can go start doing tomorrow. So here we go. Our topic today, because remember, we do this every Tuesday and Thursday, different topics. Today's topic is consignment. So we're going to go through consignment, and I really kind of want to pick apart this whole thing of consignment. Is it a friend? Or is it faux? Okay, so a lot of people have a misconception about consignment depending on what health system you work on. And if you guys are in any of my certification programs, or if you're in any of my other trainings, you know that I always talk about every health system does something different. Not every health system is the same. So depending on what health system or hospital you work for, it could be the way you guys have it structured or the way your finance team has decided to do things within consignment. It may be friendly to you or it may not be. So we're going to kind of go through some of those things, but always remember every health system is super duper different and you're all doing things very, very differently. So it's not a one size fits all. Some key takeaways of today's training are consignment is not free money. I want people to realize that consignment actually comes with a cost. And this is where hidden costs actually creep in if you don't have a strategic partnership. Vendors don't just get the keys to your shelves. I want you to remember that. They need to work hard. The vendors need to work hard to build a strategic relationship with you and your team when it comes to consignment. And same with you. Remember, and I've said this in many of my trainings, a relationship with a vendor is 50-50. You can only hold each other accountable, and they're only as good as you hold each other accountable. So it's a 50-50 relationship. Contracts protect everyone. So we have to spell out everything in detail in the contract of how a consignment relationship works. So I want to make sure that we're going over that. We want to trust, but verify cycle counts, KPIs. Those are all things that keep us honest. And consignment only works if everyone agrees together to it. Right? I cannot just have us dictating something on the hospital side or a vendor dictating something on their side. We have to agree to it. So those are some of our key takeaways for today. And let's jump in. Hopefully you guys are excited. So first of all, some people are like, what is consignment? Because if you're working as a buyer or maybe a data analyst in your informatics team or your decision support team, maybe you never work with consignment, so you don't know what it is. It is where vendor owns the product until it's used and it sits on our shelf in the hospital setting. Okay, but the vendor owns it. They're usually the ones managing it as well. It is common in our most high cost, low turn categories. So majority of our procedural areas, implants, specialty devices, cath lab, interventional radiology. Those areas are where you'll find those high cost, low turn categories. But because we have a patient that's coming in for a case, we may need to have access to those things right away. So we want them sitting on our shelves. So that's what consignment is. From there, I'm going to go through some pros and some cons. So the pros, when consignment works, number one, it reduces cash being tied up. Now, please don't construe this for this means savings. Okay. It just reduces cash being tied up. And you guys have taken my certification programs. You know that cash preservation is very, very important for your bond rating, your financial outlook of your organization. Where does the cash sit? This is great because the vendor's holding the cash, not the health system. It also ensures availability of critical items immediately when the patient needs them. So 24/7. If you are doing some kind of a cath lab case at an odd hour or on a weekend, it ensures that you have the availability of those critical items when they're needed, right? And then also it creates the supplier strategic partnership that I want you all to be building. In my other trainings, I talk about your vendor mix should be 80% strategic and 20% transactional. Most of us are 80% transactional and 20% strategic, but that's okay. This relationship actually helps you build to that supplier strategic partnership. Okay. So let's go over some cons or risks in doing consignment. All right. Number one, there could be hidden carrying costs and markup that comes along with it. Remember, I told you this does not come for free. It's a service. So of course, those products are going to cost a little bit more than usual. But plus, there's possibly some hidden contract terms within a consignment agreement that is going to make you think twice if there's a penalty or some other hidden cost built into that. Number two, there's vendor control of the stock and the stocking location. So, unless you have some kind of agreement or a procedure where everyone is helping out to control the inventory, and if you just give the keys to the vendor and say it's all yours, that could possibly be a risk. So you want to be able to balance that and review the risk of that and how you're going to manage what that looks like. Number three, compliance and expired inventory risk. So if you have it written into your contract terms with the vendor that you have the risk of expired inventory, or you have the risk of compliance of not purchasing enough, or you've got some kind of contractual commitment that you have to go through in your contract and you don't have those terms buttoned up, you have a risk there. So be very, very careful. Okay, so really thinking about governance. As you guys have taken my other trainings, maybe even my certification programs, I talk about governing everything. There has to be governance around your decision-making processes, how you bring supplies in, how you contract for something. You've got to have governance and policies and procedures around everything. Consignment is no different. You truly have to govern your consignment process. And my expectation is you've got some kind of governance around all the procedures that tie to consignment, all how you do your contract language. You're governing your policies. If you have policies around it that are different than procedures, procedures are internal, policies are things everybody has to stick to, and really outlining that an important relationship with the vendor and with the clinicians. All these things are important. So good governance has, remember, this little slide I have here in my computer right there in my computer picture shows being accountable, being transparent, being responsive, being consensus oriented. Everybody participates, inclusion, following the rule of law. It's efficient. That's what good governance is, right? But within consignment, you need to make sure there's contract clarity. Does your team from your legal department have actual clauses that are specific to consignment inventory or consignment contracts? where the ownership lies, who has liability, who manages the inventory, who manages expiration, and who gets billed for expired products, who takes on the risks of what and where. I've even done exhibits in my contracts with my procedure of how we do walkthroughs, who's involved, who approves and signs off on every time we do a change of our par levels. All those things could be inside of your contract language, and that's great. So, and I'm going to go through some of that here very shortly. Cycle counts with your suppliers. Who's managing those? Who then checks them? Do you do random audits of those? How do you make sure that you're holding each other accountable to those to make sure that there is no errors? When it doesn't matter if we as a health system or the supplier is actually doing the cycle count of what is on the shelf, when a human is doing it and not a robot, there's going to be errors. So there has to be some trust within that, right? And then thinking about KPIs that you guys could build together as strategic partners, thinking about usage versus consigned inventory value versus maybe expired products. So you can see trends and you can see your baselines and where you started. Maybe you want to see, hey, how many times are we utilizing it in a year? Maybe we can use that data to talk to the clinicians to say, let's remove it off the shelf. We're not using it enough. Obviously, we don't have enough patients coming in to utilize that item enough. KPIs, data is always king. If you guys have been following me for a long, long time, I talk about data visibility. It tells a story. So you've got to be governing your process with data. So it's pretty awesome. Okay, moving on. Consignment must-haves. I'm going to kind of go through a couple processes, especially when we get to your massive action checklist for tomorrow. But it's got to have mutual review. It's got to have accountability. You've got to have your contract terms. You're going to have a strategic three-way partnership, and I'm going to tell you what that is. We talked about your KPIs already to drive accountability and visibility. You must have trust. You must have a clinically integrated supply chain. Now you're like, what is that? I have a whole certification module on clinically integrated supply chain. It is where supply chain does not make the decisions. Clinicians come into the decision-making process alongside supply chain, and you make those decisions together. And then, of course, you need to have standard work. And if any of you guys have lean operating system or high reliability organization, or you're within one of those lean methodologies within your organization, I can guarantee you have some kind of standard work. And then within that, you're going to build these really nice dashboards with colors, and you're going to see trends, and you're going to be able to have great, intelligent conversations with each other as you're holding each other accountable. You're doing mutual reviews, you're doing walkthroughs, and you're creating standard work and trust with each other so that you've got this great process. So let's kind of dive into what all that means. So I'm going to break this down for you guys. Mutual review. And I love doing this. This is how I've done it at the current place I work, at the last place I worked, and the place before that. We've always come up with this procedure. Now, if you guys need help with writing your procedure, let me know. A walkthrough should be three-way: supply chain, the vendor, and your clinician of that procedural area. Who's accountable? Usually it's a nurse manager or maybe surgical interventional services director, whoever has accountability and can make decisions during a walkthrough. Now, these walkthroughs, I love them to happen quarterly. If they have to happen biannually, so be it. But remember, You're not making any changes with that vendor to your par levels in the period you're not doing that walkthrough. So if you're only going to do your walkthrough biannually, you're not changing any par levels in that 6-month period. That could be a little disastrous for you, especially if your utilization changes based on population and census of your patients, right? That's why I love quarterly. Our teams walk through with our consignment vendors every quarter, supply chain, a clinician, and our vendors quarterly through the space. And we agree together on our par levels. Do they need to be adjusted up? Do they need to be adjusted down? Does the item need to be removed? Does anything need to be added? So there's 4 things that I just called out there. We go through our contract exhibit of what is in our inventory together. We have 50 items with this vendor on our shelves. We agree to all 50 of those items. Maybe we're going to remove some of them. Maybe we're going to add a couple more items on top of that. We bring that through our new product introduction process, which for us, many of you use Lumiere, whatever that may be. And then maybe we're just changing some par levels of those 50 items, some up, some down, some will just stay the same. We agree together, supply chain, the vendor, the clinical person who is assigned to that walkthrough. We look at the levels, we agree, we all 3 of us sign off on that exhibit. It gets sent to the strategic sourcing and contracting team. They redo it nicely in Excel. They make it look good. Then it goes out for approval and signature by whoever the signer is, right? For who has signature authority for your organization. And it gets then saved with the contract in your contract repository, whether that's in Workday, PeopleSoft, or Oracle, Infor, whatever you have, Lawson, Cloud Suite, wherever that is, you save that contract. Then you guys are going to do another walkthrough in a quarter from now with that same vendor. All you have to do is pull up the last exhibit you agreed on and signed. That's your starting point. That's your baseline. And now you do the whole process over again. This way, vendors are not coming in randomly on a Tuesday, a Friday, once a week, and changing par levels without you knowing. It's agreed on. You do it together, and everyone's on the same page. Everyone approved it. Everyone signed off on it. So that is the mutual review. And honestly, this kind of drives into accountability, which is the next part of this process, but it helps everyone also stay accountable. Remember when we had the conversation? Oh, look, on the exhibit, we all signed off that the par level for that catheter is going to be 5 on a monthly basis. There are always going to be 5 there, right? And you're all keeping each other accountable. Now, as we move into accountability, we need to make sure that we have some kind of vendor access, credentialing, control policy, whatever you call it at your organization. How vendors sign in. Do you use VendorMate? Do you use RepTrax? Do you use Green Security? What does that look like? I'm a vendor. I'm coming on site. I'm going to be going to the cath lab to do my 3-way walkthrough, or hey, it's my once a week check on the inventory to make sure that the par levels are accurate to what we agreed on in the exhibit. What is your vendor access and control policy? How do they sign in? How do they create an appointment? Do they wear a little sticker badge? What does that look like? And then, hey, if they're doing something outside of the agreed upon process, maybe they are messing with a par level in the middle of a quarter. Maybe they are doing something that we did not agree on. Do you have some kind of a letter process to say, hey, I'm sending you just a reminder letter. We call them where I work a reprimand letter. I know that sounds kind of disciplinary, but some kind of holding somebody accountable letter that goes out to the vendor representative, reminding them, remember, this is our process. This is what we agreed on. Attached is our exhibit. Attached is our control policy, making sure that you're staying accountable to what we all agreed on. That's how you hold your vendors accountable. And that's not just for the consignment process. That accountability policy can be used for anything else that you have in that policy. For example, we have, hey, when you drop off a tray in our central sterile processing area, you have to pick it back up within 72 hours. That's in our policy. We have policies around, please do not bring something in that's not approved unless it's been approved through our value analysis process. There's going to be many things in that vendor access and control policy. If you'd like to work on one together with me, let me know. But if somebody's not following that policy, you've got to then have some way that's agreed upon that is going to be your disciplinary process, and how you remind them of, hey, you're not following our policies and procedures. You're not following our contract terms, right? Things like that. Making sure that your contract terms are solid, right? So working with your legal team, coming up with some really good separated out contract terms that are specific only to consignment agreements. I am sure there's 3 or 4 or 5 different clauses that would be very specific to a consignment agreement. Something around, hey, who's managing the inventory? Who's actually coming and replenishing them? How often is that cadence happening? Is it once a week, twice a week? What does that look like? And it may be different if you have 10 hospitals and one's a trauma hospital. Maybe they're coming twice a week to that hospital and once a week to the other hospitals, right? You want that in your contract terms. How are you doing that 3-way walkthrough? Put that in your terms and conditions. Who pays for expired product when they come in and do their inventory rotation? Who's pulling the expired items? And then who's paying for those things, right? All those things must be in your contract terms. And if you guys would like some help with what should be in my contract terms, and I need some help with, 5 or 6 different terms that should be in there, let me know. I can help you guys with that. But you've got to have some very specific consignment contract terms that are solid. Then you've got to figure out that this partnership is strategic. So I want to know, are you classifying your vendors or suppliers as transactional, strategic, integrated? Do you have ways that you are categorizing your vendors today? And what does that look like? So if you have a strategic 3-way partnership with your consignment vendor, let's just say it's Cook Medical or it is Boston Scientific, right? Because those are some of the standard ones in the cath lab for consignment. Outlining, what does that strategic partnership look like? Okay, yes, you're managing consignment together, but there's other strategic things you're doing with that vendor outside of even consignment. What does that mean when you do an RFP with them? How do your quarterly business reviews look like? All of these things need to be outlined in that strategic 3-way partnership, and have your clinicians at the table. This is clinically integrated supply chain. So you've got to make sure that everyone is involved. It's a great way for clinicians in the cath lab to say, hey, I'm having problems with Boston Scientific, or hey, I'm having problems with Cook Medical, and this is what they are. Okay, let's talk about it at our monthly meeting or a quarterly business review, right? So you've got to break down what that partnership looks like. You're going to want to make sure everyone has collaborated on what KPIs are going to drive accountability and visibility. And my suggestion is, supply chain, your clinicians and your vendor sit down in a room and you say, what do you want to see? What does the health system want to see? What does the vendor or supplier want to see? Maybe they want to see some KPIs as well. And then who is going to run those, pull the data? Where's the data source of truth coming from? Is it your system? Is it the vendor system? What does that look like? You also want to make sure that you have all collaborated on how we're going to build trust as a team, the three of us. And I keep saying clinically integrated supply chain, make sure your clinicians are at the table. Their feedback is very important. They are at the front line. And then if you have a lean methodology, I can guarantee you're going to want to have created standard work, procedures, policies. This is our standard of what our dashboard looks like for our KPIs, for consignment. You're going to want to have standards in what that work looks like. Okay, biggest key takeaway, consignment works for you only if you control the rules of it together. And this is moving you guys from a transactional partnership where I am just exchanging money for a widget, for this pen, right? To it's strategic. We're working on more than just the transaction of money for a widget, right? So you want to make sure, and as I do all these certifications and training with you guys, that I'm moving you from transactional to strategic with all of your vendors and suppliers. Now it is time to take massive action tomorrow. I am going to give you guys a checklist along with this PowerPoint and with this recording so that you have it. But here's your massive action list. And I actually give you in the list some even breakdown of what does it mean? How do you do it? So that you're not just getting the list, but you're understanding how you're going to do each piece of this puzzle. First things first, review your current consignment contract template with your legal team and button it up. Okay. Second thing, review your vendor access and control policy. If you don't have one, work on one. Make sure it matches your standard work and your procedures, and make sure that your clinicians know all about it. Make sure it's uploaded into your vendor mate, RepTrax, or Green Security. Make sure every vendor is following that policy. Create your corrective action process, your disciplinary process. How do you hold each other accountable? And it should be two-way. So if a vendor says you're doing something wrong, they should be able to have a corrective action process with you. And then vice versa. What does that look like? Review your walkthrough process to set your par levels. Do you use your exhibit signed by all three parties to agree on your levels and review again on your regular cadence? What's your cadence going to be quarterly, biannually? Who is going to be your key stakeholder in each of your departments? Cath lab, interventional radiology, your OR, wherever you're doing consignment processes. Make sure you know who your stakeholders are. And you've got to just make sure that you have these processes and procedures in writing, right? Because you want to create standard work. You want to create your KPIs to show visibility of your process, create them together at the table. All three of you sitting down. What do you want to see to tell the story? Become strategic partners. Do not stay transactional. How do you become strategic partners with those vendors that are in the consignment space? And last things, one of the most important, if you're leading towards lean methodology, create standard work. Procedures for your department are critical, and policies, because you have to be able to hold people accountable. That's why policies work the best within your organization. Figure out if you have policy templates, figure out if you have procedure templates, what do they look like within your lean methodology, and utilize those right away. So that is what your massive action worksheet's going to look like when I get it to you later on today. And I want to thank you guys for being here. Really, if you guys need to contact me, find me on my website, healthcaresupplychainhub.com. reach us and me and my team at customer service at healthcaresupplychainhub.com. And I will see you guys on the other side. So thank you for joining me. Hopefully you found tons of value, and I will see you guys again on Thursday. All right. All right. I'll see you then.
Thanks,
Bye,
Angela.
everybody.